information, that 866 number, in addition to the access code. So please utilize those two pieces of information in order to hear the audio, and we'll go ahead and get started today. Just going to make sure that it's recording, and it looks like it is. So again, just a little bit of housekeeping. The audio call-in information is there provided. All lines are muted throughout the presentation, and at the end of the session, you all will be able to provide your questions both throughout the presentation and at the end in the Q&A section down in your lower right-hand portion of your screen. So welcome to the presentation here this morning. We are pleased to National Milk Producers Federation and the Farm Program are pleased to partner with the Merck Dairy Care Animal Health Group to present this calf care webinar. The Merck Animal Health and National Milk Producers Federation formed a partnership over a year ago to help ensure a comprehensive industry-wide approach to employee training and animal care in the dairy industry. Through the partnership, dairy producers across the country have access to tools, resources, and workshops available through the Merck Animal Health Dairy Care Initiative, an extension of the Dairy Care 365 Animal Handling Training Program. This webinar series further builds upon the strong partnership that has been forged in support of the significant efforts of dairy producers to continuously improve the care and handling of their animals. This is the second of 10 webinars that will cover a variety of animal care topics, which are designed to help dairy farmers meet the new requirements of Farm version 3.0. The live webinars will also be recorded and hosted on the Farm website for viewing later, along with the Merck Animal Health Dairy Care 365 animal handling videos and training modules. The Dairy Care Initiative was designed to complement the Farm program and helps producers meet farm requirements, including creating a cow care agreement, developing written standard operating procedures, and providing employee training. The Dairy Care Initiative was developed to help dairy farmers provide the best animal care by maintaining sound policies, hiring the right people, and making sure that they are properly trained. Since its creation, over 50 workshops have been held in 23 states to help dairy farmers and their veterinarians tailor the dairy care materials for their farms. And the Dairy Care Initiative does include a comprehensive resource guide, Dairy Care 365 video training modules in both English and Spanish, customizable templates for animal care policies and SOPs, and also free workshops for farm owners, herdsmen, managers, supervisors, and veterinarians. Today, we just, if you want to access the full schedule of the webinars that will be available throughout the fall and into the winter, you can click on that link there that will take you to that. And also, if you have any further follow-up questions after the webinar concludes, please feel free to contact the the National Dairy Farm Program at dairyfarm@nmps.org. Just as a preview, our next webinar will feature Dr. Jan Shearer, and he is a professor at the College of Veterinary Medicine at Iowa State. That next webinar will be October 20th at the same time, 12 o'clock Eastern, and he'll be covering euthanasia guidelines. So just mark your calendars for that. And today's speaker, we are pleased to have Dr. Liz Cox joining us today. Dr. Liz Cox is going to discuss the top quality care of calves. So it is critically important to have quality care for calves from trained employees, along with positive human interactions favorably impacting a calf's future performance as a milk cow. Dr. Cox will explain good stockmanship practices, colostrum management, water and feed availability, and written protocols for newborn and milk-fed calf management. She'll also review handling and movement, employee training, and ways to reduce stress during processing. Dr. Liz Cox is a dairy technical services veterinarian with Merck Animal Health, and she dedicates her time to calf health and milk quality. For calf raising operations, she assists in the implementation of data capture, management, and analysis for herd health decisions. She's developed and executes the use of lung ultrasound in dairy calves to detect respiratory disease and has trained other veterinarians in this technique. She believes in the judicious use of antibiotics and has extensive milk quality laboratory experience, including on-farm milk quality labs. Spanish is a second language for Dr. Cox, and she enjoys performing training in Spanish to dairy employees. Before joining the team at Merck Animal Health, Dr. Cox worked in private practice in California's Central Valley. So today we'd like to welcome Dr. Cox to present on our calf care, on the calf care aspect of this webinar series. So Dr. Cox, I will turn it over to you.
Great. Thank you so much, Emily, and welcome. Thank you to everyone for joining us today for this very important topic that I'm also very passionate about. And there we go. So here is an outline of the objectives for this presentation that we'll go through this morning. So after this presentation, you will have a thorough understanding of the updated Farm 3.0 guidelines centered around calf care. And we'll also go through examples of how to implement those guidelines on your operation and where your veterinarian fits in helping to execute these expectations. Your veterinarian plays a very important role on your farm, especially around calf care. And so we'll have examples of how your vet can help you with these new requirements and expectations. So as we go through the objectives and thinking about calf care, the future of your operation, we're going to cover the herd health plan, which is required with Farm 3.0. And within that herd health plan, written protocols of standard operating procedures on farm are required. So I'll go through examples of those and some best practices that are outlined to follow with the protocols. And examples of those protocols including nutrition for your young calves and newborn calves, environment that they are housed in as milk-fed calves, and then also transportation of young calves and then into weaning as well. So the format of this slide will be throughout my presentation, and here I have title at the top, Farm 3.0 requirement. And throughout the presentation, I will review these different requirements that go with the updated version of the farm program. So the first one here is regarding the herd health plan. So every operation must have a written herd health plan, and this is developed in consultation with the veterinarian of record, so the veterinarian that you have your veterinary client-patient relationship with. In this herd health plan, you will have the protocol for various aspects of the calf raising part of your dairy or operation. And with each of these protocols, an important aspect to remember is that employees need to be trained to the protocol. Documentation of the training needs to be within your herd health plan. And then also this is a living document. So the herd health plan needs to be reviewed and updated at least on an annual basis in consultation with your veterinarian. So protocols, certainly a very big part of the herd health plan, and the Farm 3.0 guidelines give you great examples of the protocols that will be needed on your operation. Included in that would be how calves will be daily observed for signs of potential injury, disease, and general health. And of course, how your employees will be trained in order to make these observations and record them. Protocols will also need to be developed for the treatment and management of calves that potentially become sick or injured while they're on farm, and then vaccination protocol as well. And again, these are all things to work with your veterinarian on I'm sure that most of you have already taken a big start on this, and especially with your vaccination protocol and reviewing that on an annual basis with your veterinarian. So thinking about the newborn calf and our calf care on farm, this is a list of protocols that the farm would like you to have on farm and written on your operation and written documentation. So colostrum for newborn calves, management and administration, navel dipping of new babies, the way that you're going to be feeding milk to young calves that are on the early milk diet, pain management, transportation of young calves, and then handling of animals that are injured or down, and then euthanasia as well for animals that need to be euthanized on farm. So these are some of the protocols, and throughout the presentation I'm going to review some of the best practices that then are outlined in the Farm 3.0 guidelines that go along with these different protocol examples. So here's another requirement for Farm 3.0, and that is that each animal is permanently identified on farm. And so we would recommend that this is done soon after birth. As soon as an animal is born, they need to have a permanent ID placed on them so that then you can begin keeping a record on the history and life of this animal on your farm. So keeping good records is very, very important. So for the permanent identification, we recommend that this is done during the new calf processing by your employees. So other protocols that will be required for you to have written and then for your employees to align behind would be the movement of diseased and injured animals, how you will be handling them if something like that happens to them on farm. Parasite and fly control. So certainly with our animals being outdoors and in the different changing weather, flies and external parasites and internal parasites can be a factor in the lives of the cat. So it's important to have a plan on how to manage and control parasites and flies. Lameness prevention, this is not only isolated to adult animals, it's important that we prevent lameness in our young stock as well, and pain management. And you'll see throughout the best practices examples that I go through, pain management is a very important theme with Farm 3.0. And it's important to remember that pain management, a plan for pain management will be needed with animals that potentially become sick, and then also for your planned routine procedures. And remember that record keeping is always important aspect of all of this. We want to document how well you are doing on farm, and so you can keep track of your efforts. So a Farm 3.0 requirement is that there is a vaccination protocol, and within that vaccination protocol, specifying the age of animals, the product that will be used, and then the proper route of administration. And this is something that, you know, most dairymen do very well, and you work with your veterinarian on. It's important, though, to review this at least on an annual basis with your vet and update and make changes to the written document as you potentially change your practices on farm. So I'm going to review some of the best practices that do go along with the protocols that are required for the calf care on your operation. So navel dipping, we all know that this is very important for young calves, but after birth, their navels are dipped with a disinfectant, and this is to help prevent diseases that can be very detrimental to young calves. So it's important to train your employees on the importance of navel dipping, and then to check and make sure that they are doing their jobs by going out on farm and inspecting for yourself that navels are being dipped. In regards to our best practices around colostrum management, there is the requirement that all calves born on your operation receive colostrum or a colostrum replacer soon after birth. And so this is going to include all animals, so heifers and bulls that are born on your operation, and even if the animals are being transported off the farm. Even if you're not raising the calves on your operation, when they're born and under your care, you need to administer colostrum or a colostrum replacer to them. And also with nutrition, animals that stay on your farm and that you're raising yourself, it's important to feed those calves a volume and quality of milk or milk replacer to meet the needs to maintain growth and health in the young calves until they are weaned or moved to another location. So for colostrum, as far as how much is the right amount for our young calves, it's important that a calf receives 10% of their body weight of a high-quality colostrum or colostrum replacer. So there can be variation in the size of calves born depending on the breed, and even within a breed there can be differences of sizes. So it's important to train your employees on giving the correct volume of colostrum depending on the birth weight of that calf. And it's very important that this colostrum is given within the first few hours of birth. We want to administer a high-quality colostrum. So in order to have high-quality colostrum, the cow needs to be milked very soon after she does give birth, because colostrum quality, meaning the amount of antibodies in the milk, that quality will decrease if you wait too long after the cow has given birth to harvest the colostrum. And there are some great tools to check on farm very quickly the quality of the colostrum before feeding it to the newborn calf. A Brix refractometer or a colostrometer. Both of these tools allow you to check and see that you're only feeding the highest quality colostrum as that first feeding to newborn calves. A Farm 3.0 requirement is that all animal caretakers are trained in calf care, nutritional requirements, feeding techniques, and this includes the training in the use of an esophageal tube feeder or any other feeding mechanisms that you use on your operation. So use of an esophageal tube feeder is often very common practice on farm regarding colostrum administration. It's important that your employees are trained in this technique and that training is documented. So with nutrition in these young milk-fed calves, they're getting all of their caloric needs for maintenance and for growth through the milk that you're feeding them. So we really encourage people to look at their feeding practices and potentially make modifications to encourage more milk feeding than traditionally maybe you had been doing. So doing more milk feeding, there's different approaches. You know, you can add another feeding in the day. You can increase the volume you feed at one of the times that you do feed during the day, or you can increase the caloric density of milk that you feed. Doing this, it's always important to remember that if the calf is eating more from the mouth, there's going to be more coming out the back. And this is okay, this is normal, it's great. Calves are eating more, so potentially there might be loose feces. It's not associated with health problems. It's just they're eating more milk, and so we see more out the back. Other best practices regarding the milk feeding of calves would be to offer this milk via a nipple versus the bucket feeding. So nipple feeding is more similar to the way a calf would nurse from a cow, and it's good for the calf to have that suckling motion when they are drinking the milk. There's two pictures here, you know, on the right there. You can see a mob feeder where the calves have free choice of milk and they can access it via nipple anytime they want, or The other way is delivering that milk at a timed feeding in a bottle with a nipple. And then as calves become ruminants and are going on to solid feed and the calves are weaned off of milk, it's very important that that is done as a gradual weaning process and not an abrupt stopping of the milk. So gradually weaning those calves over a week to 2 weeks to ramp up how much solid feed they're eating as they slowly go off of the milk. Another Farm 3.0 requirement is that our newborn milk-fed calves have access to clean, fresh water as necessary to maintain proper hydration from the first day of life. So access to clean water starting on day 1 of life for our young calves. With nutrition, again, I mentioned feeding more milk. So it's important that the amount of milk that you are offering and that is in your nutrition plan is enough milk to meet the nutritional requirements for animals to maintain body weight, to grow, and to be healthy. Along with the milk, of course, we want to offer them starter feed, offering calves their starter grain, just a little bit, but from the beginning of life, to go along with the milk as they start to transition to a solid food diet. And also understanding that there are changes in environmental temperatures, which we'll talk about more, but you might need to adjust your nutrition program according to how the weather changes where you're living. The Farm 3.0 requirement for disc budding is that disc budding or dehorning is done before 8 weeks of age. And with that disc budding and dehorning, that there is a pain management plan that you work with specific to your operation under the recommendations of the herd veterinarian. So again, for disc budding and dehorning, required that it's done before 8 weeks of age would be the best practice. And as far as coming up with a pain management plan, this is something for you to discuss with your veterinarian and have him or her make recommendations that are specific to the needs of your operation. And in the Farm 3.0 guidelines, it does state that if calves are missed or going to need to be dehorned after 8 weeks of age, this is considered a surgical procedure and would need to be performed by your licensed veterinarian. So it's really important to have that plan in place and train your employees to do disc budding and dehorning before 8 weeks of age. Another possible planned procedure on your operation if you are raising bull calves and turning them into steers would be castration. And we encourage you to castrate calves that you know are going to become steers at the youngest age possible, and this can be done within the first week of life. And castration, along with disc budding and dehorning, these planned procedures, again, need to have a pain management plan for your operation, and that will be developed by your veterinarian that knows your herd the best. Another routine practice that we often need to do in our heifer calves is the removal of extra teeth. And we encourage you to observe the animals and remove these extra teeth at the youngest age possible, as far as when they before they have fully developed. And also just to remove the ones, a best practice would be to remove the ones that are necessary to be removed, in that they will interfere with milking. And again, this planned procedure, a pain mitigation plan, can also be developed under the veterinarian recommendations for the planned procedure of removal of extra teeth. So Farm 3.0 requirement for all animals, all classes and ages, is that animals are able to stand up, lie down, adopt normal resting postures, and have visual contact with other cattle without risk of injury. So this is a very important farm requirement for your cows and then also for your calves, and thinking about the way that you have developed your facilities for your calf raising operation, or if you potentially are going to be updating or changing your calf facilities. Within the environment that the calves are living, it's important that it's a safe environment for them and that the environment prevents body abrasions and injury. It's also important to have a plan to minimize airborne particles, so thinking about dust, which we can certainly have on an operation, especially potentially in the summer or during periods of farming. It's good that there's a plan in place to try to minimize and control airborne particles around young calves, and that the calves are provided an area that provides cushion, warmth, insulation, dryness, and traction. So a comfy place for our calves to call home while they're under our care. So we know that calves certainly show a preference to snuggle up in a clean, dry area with bedding, and if given a choice to take a nap in a nice, comfy place as opposed to lying on concrete surfaces. So it's important that we give calves the choice to have access to a clean, dry, comfy area to lie down. And also in the farm guidelines, it does talk about group housing and the benefits of group housing in regards to social interactions for young calves. We know that cattle are a herd animal and certainly enjoy being with other calves or with other cattle. The Farm 3.0 has the requirement that 90% or more of all animals score a 2 or less on the farm hygiene scorecard. And this scorecard is, the range would be that 1 is clean up to 4 is dirty. So it's important to remember in the housing and environment for your calves as milk-fed calves or as young weaned calves that we need to make sure to maintain their environment, that they're in a nice, clean environment as weather changes. As weather changes, this Farm 3.0 requirement applies to, and that is that all classes of animals are provided with a reasonable means of protection from heat and cold. So as we're coming into winter, making sure that we have an environment for the calves where they can keep themselves warm, and this might be larger requirements depending on where you live and where you're raising your calves, and then also thinking about into the summer and heat stress. So we need to make sure that we can keep calves warm in the winter and cool in the summer. So the thermoneutral zone for our young calf is a little more narrow than it is for an older calf and into our. For a young calf, the range is 50 to 78 degrees Fahrenheit, so they're not as cold tolerant as very older animals. When calves are about a month old, older calves and then adult animals, their thermoneutral zone ranges from 32 to 73 degrees Fahrenheit. So they have a little bit of a larger range and a little more cold tolerant. So it is important with our young calves coming into winter that we provide the bedding, the jackets, the environment to help keep them warm, because the energy requirements as we go into winter will increase if the calf is having to maintain body temperature without the added bedding or housing requirements. So thinking about summer, which we've just come out of, adjustments will need to be made as well, thinking about next spring and heat stress for calves. So when it is hot, calves drink more water, and producers often ask me, you know, well, what's the water requirements for a young calf, and how much water do they drink? And my answer is always as much as they want. So the goal is to keep clean, fresh water in front of animals at all times, so they're allowed to drink as much as they need. Also providing shade. You can see in the bottom picture there, animals having a preference to rest in the shade as opposed to resting in the sun when it is hot and there's heat stress. So Farm 3.0 requirement in regards to the transport of young calves. So young calves need to be moved by lifting, walking, or using clean, properly designed mechanical transport devices. And again, animal caretakers, like the person in the top picture there, they need to be trained to handle and restrain calves with minimal stress to the animal. So this is very important in regards to thinking about your facilities and tools that you do give to your employees. Young calves can be very heavy. A newborn Holstein could potentially weigh up to 100 pounds. And so it's important to have the tools and training for your employees to keep the animals safe, and then also to keep the employees safe as well. So documentation, this is a Farm 3.0 requirement, and I have mentioned it briefly already, but with your herd health plan, you need to train your employees, and all of that needs to be documented. So you need documentation for the training of all your employees on farm, new employees and existing employees. And this training will be about the animal care, the stockmanship, their specific assigned animal care responsibilities. And again, this needs to be reviewed and updated at least on an annual basis. So they will need to be trained and then retrained. So train, and retrain. We've said this a lot at Merck Animal Health with our Dairy Care 365 training, animal training module series. And if you aren't familiar with it, through the Dairy Care 365 website, as Emily mentioned at the beginning, we do have training modules available in English and in Spanish for dairy producers and calf raisers to access in order to help with the training of employees on farm. So examples of the videos that we have available is our introduction to dairy stockmanship, bringing cows into the milk parlor, euthanasia, and then specifically to calf care, we have two modules. One is the care of calves from birth to 2 weeks of age, and then we have another one centered around weaning and management of calves in the group pens. And again, these are available online through the Dairy Care 365 website. They're in English and in Spanish. There is a quiz, a short quiz at the end of each of these training modules to help test the knowledge of your employees. And then you can print out a certificate with the employee's name that you can keep as documentation that they have participated and passed the training for these different modules. So as Emily mentioned, Farm 3.0 is about continuous improvement. As we reviewed the different requirements today, some of them probably seem familiar from the previous version of Farm and are new. And it's important that we embrace this and know that we can always improve and do a little bit better. With this Farm 3.0 and making your herd health plan, there's a large role for your veterinarian in this, and we really encourage you to work together with your veterinarian to outline these protocols, and your veterinarian can also help with employee training. Documentation, again, of all of this is really, really important, especially in regards to the protocols and for your employee training. And we think that, you know, this will pay out for you, of course, and that the calves are the future of your operation. And we know that taking good care of your calves when they're young will ensure that they're healthy and productive animals in your herd when they grow up. They're the future of your operation. So thank you for your time and attention, and I just ask if there's any questions for me.
Great, thank you, Dr. Cox. This is jump on here. Again, my name is Emily Yeiser-Stepp. I'm the director of the farm program here with National Milk Producers, and we do have a few questions for you. And just as, again, a housekeeping note, for those of you who do have questions of Dr. Cox, please feel free in the bottom right-hand corner. There's a Q&A section of your screen where you can type in a question, and that's where we will be able to see all the recorded questions, and I will ask those of Dr. Cox. So, Dr. Cox, we've got a few in here. When you were mentioning the milk aspect of things, do you have a preference or insight on whether milk should be pasteurized or not, and what your best management practice would be from that standpoint?
Yeah, great question. So for the feeding of milk to our young calves, you know, the goal is to feed clean, consistent milk on a daily basis. So consistent meaning that the total solids in the milk is the same from feeding to feeding. And then clean, of course, that there's a low bacterial count in the milk. So pasteurization is an excellent way to accomplish that. So in general, the best practice I would recommend is making sure that the milk is pasteurized before it's fed to calves, and that also you routinely monitor that pasteurization to make sure the pasteurizer is working correctly.
Great, thank you. Another question that's come in is, how do you balance the need for the calf to get colostrum with the requirement that they have for water on day one? How do you balance that and the importance of offering water on day one of life?
Yeah, so we know colostrum is that very important first meal for a calf. And so whether you're offering the colostrum with a bottle and a nipple, or if you're feeding the colostrum with an esophageal feeder, we know that that's very important. And then the water requirement is about calves having free choice access to water. So wherever you're putting your calves after they are born, making sure that there is water available for them, so it's their choice, but they have access to water if they are thirsty starting on day one of life.
Great, thank you. Kind of in that same vein, in the first few hours of life, what are some of your recommendations, or what type of disinfectants that should be used for navel dipping? Anything in particular or that you would recommend from that standpoint?
Yeah, navel dipping is important, and I always recommend, and just to stick with tried and true, the strong tincture of iodine, so the 7% iodine as the disinfectant of choice for navels to be dipped. And I also really like using the dipping action. I do sometimes see on the farm people use a spray bottle to apply that 7% iodine, but I still really like using a dip cup so that you can really submerge and get the end of that navel covered with the iodine for disinfectant purposes. And then it's challenging to dip a navel too many times. So we recommend, that navels are dipped soon after birth, but then it's great to dip them again. Maybe you dip them again when you move the calf into their their new home, and then you can dip again later in the afternoon. So you can do it once, and it's great to do it more than once.
Excellent. Question came in, how do you feel about frozen colostrum from the cow or frozen colostrum from a company? From your perspective, which would you recommend that is better for the calf?
So both of them can work really well. It depends on what a farm is able to manage. So for feeding colostrum, the goal is that it's a high level of antibodies and that it's clean, that it's low in bacteria. So some operations, depending on when you can harvest colostrum, the people you have there to manage and store it, they can feed fresh colostrum or fresh harvested and frozen colostrum to their calves, and they can maintain that colostrum is clean and high quality depending on when they can milk the cow in their storage facilities. So that would be my first choice, would be to feed the colostrum from the cow, but if an operation can't handle that as far as the timing of milking of fresh cows or maybe the facilities for storage of colostrum, then it's better to feed a colostrum replacer than to feed dirty, low-quality colostrum from a cow, if that makes sense. So first choice would be great if it's from a cow, but I understand some people can't manage that and need to use a replacer.
Great, thank you. Kind of a follow-up question to that one. Should you give colostrum from first calf heifers? I think I'm understanding this question correctly. From first calf heifers or just multi-parous cows?
Yeah, I would do both. So colostrum from first calf heifers can be very high in antibodies and high-quality colostrum. Traditionally, maybe we thought that only the multi-parous, the older cows, had the high-quality colostrum, but heifers can have very high-quality colostrum as well. So I would recommend collecting colostrum from heifers, from multi-parous cows, and then testing the quality. So using your Brix refractometer or your colostrometer. I really like the Brix refractometer because it's less easy to break. So using the Brix, measuring it, if it's 22% or greater on a Brix, whether it's from a heifer or from a cow, then that's excellent quality colostrum to feed as the first feeding.
Super. Kind of shifting gears a little bit, why is it so important to work with your veterinarian on pain management plans for disbudding? So pain management is very important for our planned procedures on farm, and there are no approved drugs for pain management in food animals. So in order to make a pain management plan for your animals, you need to work with the expertise of your veterinarian because they know your farm and they have a very thorough understanding of the drugs and procedures that are available for use in food animals, and they can come up with a specific customized plan that then is under their care and their responsibility. Great, thanks. This one came in regarding the 365 trainings. Is there a way to personalize those trainings?
So the training modules online have already been, developed and edited and have the audio voiceover with it. So those are not able to be specifically customized. But that being said, I know a lot of farms that have made additional training videos that are customized just to their operation. One specifically would be milking routine. So every dairy has their own specific way they want the cows to be milked and works with their facilities. And so a lot of dairies have gone along and made their own training module with, we all have video cameras on our phones, and then you can edit it on your computer and customize something that's really specific to your employees. And so although ours are not able to be customized, I have seen people just do it by themselves and make some custom videos that are really well received by new employees on farm.
Excellent. There's a question that came in, your recommendations on feeding or offering electrolytes to calves.
Yeah, so electrolytes are a supplement that can be offered to calves that have mild dehydration or scours. That's probably what that's referencing. I always recommend that animals with mild or any type of scours or loose feces, it's very important to continue to offer feeding them their milk feedings as routine, and then offer them electrolytes as a supplement. So yes, if your goal is to treat mild dehydration, then after a milk feeding, in between milk feedings, you can offer oral electrolytes to calves to help with mild to moderate dehydration.
Another question, what is the minimum total protein score you would accept for passive transport?
Yeah, so a way to check that calves have received their colostrum is taking a blood sample and looking at the total protein and taking that blood sample about 48 hours after they've been born. And our research has shown that 5.5 and greater is an indication that the calves have received their colostrum and they have passed. They're not a failure of passive transfer. There is other research showing that 5.7, a little bit higher, calves with a 5.7 had a decreased risk for developing respiratory for BRD later. So I like to say at least 5.7 would be a great goal. I wouldn't say if you're 5.5 you're a failure, but if we can meet that goal of 5.7, that'd be great.
Great. Another one that has come in is if we move our calves right after birth to a calf raising facility, are there any special considerations for care that we should consider?
Yeah, so I guess depending on if you're raising them yourself or maybe they're going off farm to a different calf raising facility, but thinking about the newborn calf procedures. So what do you want your employees to do right after that calf is born? And usually it's identification, administration of colostrum, navel dipping, and then working with your veterinarian for any vaccines that your veterinarian, that is a time where people will often give vaccines as well, is soon after birth. So whatever those new calf protocols are, to make sure those are outlined and your employees know what's required of them. And then probably having a sheet for your employees to record that they are doing everything that's required of them. And then as long as the animal is in your care, making sure that the actual transportation of the calf is low stress for the animal and low stress for people. So giving your employees the tools they need in order to move and transport the animals to the new calf raising facility.
Excellent. You'd mentioned another one that has come in was regarding the extra milk or the more milk feeding concept. With that extra milk, with your experience, have you seen, you mentioned the additional manure that obviously comes with that. What type of hygiene strategies would you recommend or facility management strategies would you recommend in those calf facilities to address that additional manure accumulation?
Yeah, and so depending on the facility setup of how you're raising your calves, so thinking about a calf in a hutch outside, the calf is outside when they're eating, and usually when they eat is when they defecate. So all that extra manure is outside, and then the calf has their little house to go into where it's still clean. Calves that are in a single hutch where their manure and their eating is all kind of the same place. I do see people that either add additional bedding in those young calves through the time period of potential scours or increased manure. People also will move calves, so they will physically move the hutch to a different piece of ground, but the calf still stays in that hutch. So that's another management practice I see people do, is they'll move a whole line or a whole row of hutches, 3 weeks in, to then be on fresh ground, and the calf is still on milk, they're not weaned, but then that hutch has been moved. Additional bedding, and then if they are in a group housing situation, there might be an opportunity to actually clean up that excess manure because it's in a larger environment, so going in and cleaning it up midway through before they're weaned.
Excellent. We had one additional question come in here. What are the advantages and disadvantages of robotic calf feeders?
Yeah, that's a really great question. So advantages to robotic calf feeders. The concept of a calf can go to the robotic milk feeder when they want and have multiple small meals throughout the day, and then you're able to increase the amount of milk that they're eating. So advantages, of course, would be that the calf, you can increase the amount of the nutritional plane of the calf because it's through the robotic feeder, and you can offer multiple feedings throughout a day without the labor of people going out to give additional bottles. That usually those are also done by a nipple, which is great. So they're drinking milk from a nipple. The multiple feedings throughout the day is great for the calves in regards to, if you think about a beef calf with her mama out on the range, that calf is going to have multiple small meals throughout a day. So the robotic feeders help to mimic that. So from a gut health and nutritional standpoint, there's some great potential advantages. The disadvantages of the group feeders, usually it's in a group with the robotic feeders, is that, now we've brought everyone together, meaning all the calves are together. And if you think about kids in preschool, when they go to preschool, that's when they potentially get sick. So that's just a challenge that you have to manage, and that you have all the calves together in a group, and they're all going to be sharing everything amongst each other. So potentially if one animal gets sick, then, that whole group could get sick. The other thing with the robotic feeders, and then usually the calves are in the group housing, it's just respiratory disease and ventilation. So anytime we bring calves indoors or concentrate them in an area, it's really important to have and maintain good ventilation to reduce the risk for respiratory disease.
Great, thank you. Another one is, are there pain management options that are acceptable for use on organic dairy farms?
I don't know the answer to that. I'm so sorry. So my world, so as far as pain management on organic operations, that's something that I would recommend that you talk to your veterinarian you work with at your organic dairy, and then also talking to your specific organic certifier as far as what they will allow for you to do at your specific, where you ship your organic milk.
Great. Well, it looks like we've gotten all the questions that have come in at this point. So thank you for that, Dr. Cox. And we'll switch things over here real quickly. Just before everyone jumps off, we just want to remind you, and thank you for participating, but remind you of the next webinar series that will feature Dr. Jan Shearer from Iowa State on October 20th at noon again, and that will review euthanasia guidelines. So please plan to join us at that point. And again, just as a reminder, we just want to refer you all to the webinar series. The full listing of the schedule is on this website. Additionally, this is where the recordings of all the webinars will be housed for future reference, not for employee training and other avenues that you may want to use it. So please refer to the nationaldairyfarm.com website, or this one in particular, there's a tab there for the Merck Dairy Care and Farm Animal Care web series. And then finally, we just want to remind everyone about the Dairy Care 365 that Dr. Cox had mentioned, the Merck Animal Health program that has all of those training modules that Dr. Cox reviewed for us earlier. Finally, we remember to connect with the farm program. We are on Twitter and Facebook as well as Instagram, so look for us there, follow us there, and use the hashtag FarmProud for any interactions that you're having with the best management practices that we've outlined here today. So with that, again, we'd like to thank you all for participating and attending, and we will see you on October 20th. Have a great day, everybody.
Thank you.
Bye-bye.